morning, everyone. I'm Rahul Nanuhal, COO at Curica.com. And today we are back with our weekly Instagram live session with a special doctor to take care of your concerns. The topic for our today's discussion is safeguarding against hearing loss. Hearing loss is a very major concern these days due to very high level of noise at multiple places. Even people at their own homes use a lot of ear devices like hands-free to listen to their favorite music or to check out videos, Netflix and all. This makes them very vulnerable towards all the hearing losses. So Dr. Berenice Stella is going to help us today to understand how to safeguard us against hearing loss. She's just going to join. So Dr. Stella is going to be with us in just a few seconds. Good morning, Dr. Stella. How are you?
I'm fine. Good morning. Hi.
Great. Good to have you. Doctor, today we are covering a very, very important topic around understanding and managing hearing loss. So we have got a lot of questions from our listeners who want to understand how to avoid hearing loss, because it's a very common problem these days. People use a lot of hearing aids or let's say hands-free devices to listen to music, while driving, talking to people, and also watching Netflix, and probably they're exposed to a lot of loud noises, right? So let's try to understand how we can help them, doctor. So, doctor, the first question that listeners are asking is, what are the common causes of hearing loss?
So, hearing loss is a vast topic, first of all, and we'll try to cover as much as we can today. So, the most common causes of hearing loss starts from the most commonest of the issues like earwax. A simple earwax can be inside the ear canal, plugging in the canal and causing hearing loss. Or, for example, in children, small kids and toddlers, when they run around and play with stuff, they tend to put a lot of foreign body inside the ear. So that can be a cause of hearing loss. And the next commonest thing is even common cold. The common cold that we have problems between the nose and the ear, and that can cause hearing loss. And when we talk about the elderly population, age-related hearing loss, more than 60 years of people age, they tend to have nerve weakness, which is a normal process in everybody's life, and they can have hearing loss. And other dramatic causes like any road traffic accident, any trauma, a fracture which happens here in the skull can also cause hearing loss. And the worst comes worst, malignancy, tumors, any tumors in the ear or in the brain or in the cerebellum, a part of the brain which is close to the ear, can cause hearing loss. So hearing loss causes are ranging from simple earwax to tumors in the brain.
Understood, doctor. So, doctor, does noise exposure or listening music in earphones for longer hours contribute to hearing loss?
Yes, definitely. So when we talk about hearing loss, there is a particular term that I want to emphasize on, which is called as acoustic trauma. Acoustic means it's sound, and the trauma is the sound causing damage to the ear. So, for example, when we, when we go to a marriage or a function, we can actually visualize that suddenly when the mic falls to the floor, there is a screeching sound for a second. So that kind of a loud noise for a short duration, such audience can have a condition called as acoustic trauma. So that loud noise for minimal time can damage the nerve. So that is one part of the noise hearing loss. The other is a regular environment having a loud noise, more than 85 decibels we say. So that happens usually in people who are working in heavy factories, heavy industries where machineries are operating all the time. So such people can also have noise-induced hearing loss. And coming to day-to-day life, I think nowadays since Instagram Reels and Netflix on the go for everyone, I think all the age nowadays I can see right from the kids, preteens till the elderly, everybody listens to the phone all the time. So such kind of noise when the earphones are worn for more than an hour a day, and when the volume is more than 60%, and the person is wearing the headphones for more than an hour a day, that also contributes to hearing loss, which we say noise-induced hearing loss.
Right. Understood, doctor. So, doctor, are there any preventive measures for noise-induced hearing loss?
So, as I said, all these categories, the previous three categories that I said, the short duration, the working long duration, and the entertaining category. So this, so whenever we go to any function or anything, please avoid sitting next to the speakers. Not sit next to speakers. That is one.
Correct.
And when you go with the kids, we tend to know that, okay, we anticipate there can be loud noises there. We suddenly close our ears, or sometimes we even wear ear plugs or cotton. But the small children cannot protect themselves like that. They don't have the reflex. So it is very important when you go with your kids or any other kid there, kindly protect their ears before we protect ours, because their hearing system is much more fragile than us, and they are in the developing phase. That is one. The other perspective is, in the factories, when people are working for a long duration of time, it is better to get your ears checked frequently, so that any early prevention can be done if they pick up some problems. And people who are wearing, who are working in such conditions like industrial sounds, it is better to wear a earplug all the time. A company called 3M is manufacturing earplugs, which are silicone ones, reusable ones, very cheap. You can buy that. We can buy and wear, and that can be done. And third is for the entertaining category. Like I said in the previous question, using over-the-ear headphones are better than using insert earphones. That is one. And if we can minimize the duration of your headphone usage for 1 hour a day with less than 60% of the volume in the phone. If you want to listen to songs for more than an hour a day, it is better to actually use speakers or put your phone in loudspeaker mode than putting earphones in the ear. Understood,
doctor. I think that's a very valid advice for a lot of people, because we see people using hearing devices all the time. I'm sure that this is going to help them a lot. So, doctor, can genetics play a role in hearing loss, and how does aging affect our hearing?
So these are two questions. Genetics definitely play a role. Like any other disease, even hearing loss is related to a lot of syndromes. We have a lot of syndromes in medical practice. So many syndromes are related to hearing loss, where the child is born with hearing loss. So that is most probably because of a hearing loss called a sensorineural, where the nerves are damaged, and such hearing loss has a very bad prognosis. It is difficult to treat. Preferably, their only option will be getting a surgery called as cochlear implantation, which costs in lakhs, but it's a very good surgery. They will not be able to benefit from the conventional hearing aids. The other question that you asked is, I'm sorry, I didn't get to the next.
How does aging affect our hearing? Aging.
Age, so like how our joints get weak when we get older because of usage. This our nerves in the ears, they also tend to weaken as we age. So I would say above 60, if frequently, like maybe once in 2 years, to check the hearing is better, to pick up the hearing loss in an earlier stage. Such hearing loss is not preventable. I think it's God's manufacturing. It's 60 years, you get 100% usage of your hearing, and then it slows down. By 75, I would say more than 50% of the population in that age, they don't have 50% hearing. So that is normal.
Right, right. And typically, doctor, what age groups are more susceptible to hearing loss?
So this is again an interesting question. The extremes of age. The very young kids where their ears and the hearing system is very fragile, and in the developing phase, they can get traumatized very easily. That is one. The other is the other extreme, that is the elderly population, where I said just now, it is because of the weakening of their nerves due to the age they have hearing loss. In between, I would say adolescents or teens or middle-aged, we don't suffer from hearing loss very easily unless we work in an environment where we are exposed to heavy noise all the time, all throughout the year for many years. Then we are also in the category to have hearing loss.
Understood, doctor. Yeah. So, doctor, typically, what are the different types of hearing losses and their characteristics?
So we have 3 types of hearing loss, simply put. One is called as, it's all medical terms. So one is called as conductive hearing loss. The other is we call as sensory neural, simplified as the nerve hearing loss. The third one is called mixed, where you have both the first 2 types. So this conductive loss is basically physics. So the sound from the environment has to go through the ear, pass through the outer, middle and the inner ear, then get into the brain. So the transmission, if it is, then that is called as conductive. That can be because of anything sitting in the ear canal, like a simple wax, or when the drum is operated, when there is a hole in the drum. All these can cause conductive loss. The treatment of such conductive hearing loss is simple and easy, maybe requiring a minimal surgery, and the recovery is also good. The other type is the sensory neural hearing loss, the nerve hearing loss, where beyond the inner ear, these signals are taken to the brain. So that's a complicated system. When damage happens there, then when we call it as sensory neural hearing loss. So when the patient has a nerve hearing loss, they will be able to hear, but they will not understand the words. They will not be able to understand. They'll say, I hear the sounds and I'm not able to pick up the words that they say. That is the category, the characteristic of nerve hearing loss. Whereas in conductive, I don't hear the noise at all. So this, and mixed, when you have both, maybe on a long-standing disease, the eardrum, you can have both mixed hearing loss. So these are the types of hearing loss.
Understood. Right, right. And doctor, we have a question coming in from a listener, Prema Lata. She's saying, is there any supplement or are there any supplements to help manage hearing loss as we age? So just like doctor, she's asking, like calcium is for bone. So are there any recommended minerals, vitamins, or any supplements that we should keep in mind?
Okay, that's a interesting question, but I'm sorry to disappoint you. There's no such minerals or vitamins to actually prevent your hearing loss. But if the hearing loss is diagnosed as a nerve hearing loss and you also have giddiness along with the hearing loss, then we check their vitamin D, vitamin B12, all the values, because these play a role in the nerve of the inner ear. If the levels are low, we supplement them with vitamin B12, but such cases your giddiness can improve. Maybe a minimal hearing loss will improve, but there is nothing to prevent for age-related hearing loss. As I said earlier, I think God's time to give the ears some rest starts after the age of 60.
Wonderful. Okay. That's interesting. I'm sure, Prema, you would have got your answer. If you have got any other question, guys, please do mention in the comment section below, and we will try to take them up during this session. Or in case if this session is over, we'll try to get in touch with the doctor and request for a response. Also, we have got a free of cost WhatsApp platform on Curica.com where you can get in touch with care team experts, and they will guide you for all your healthcare concerns, whether that is related to hearing loss or that is related to any other concern or an issue, just like maternity care, baby care, skin care, hair care, nutrition, wellness, elderly care, pain management. So we cover all healthcare at Curica.com with more than 8,000 different products taking care of your concerns, and all these products are handpicked by expert doctors. So do check out Curica.com and let us know what concern we can help you with. Next is, doctor, how often should individuals get their hearing checked? And if working in industries or has a noise exposure, so these kind of people, when they should get it checked?
So people who are working in industries, dealing with machineries where the sound generated more than 85 decibel. Decibel is a unit of how exposure of sound we get. So if it is more than 85 decibel and the person works for more than 8 hours a day, probably when they join the work in such an environment, their ears should be checked within 3 months of joining, and thereafter every 2 years. It is called as an Industry Hearing Act where we have 12 categories of decibels of how much exposure and the duration of hours they work in the industry, and whatever it is, every 2 years they have to be checked. So every 2 years.
Okay. Right, right. And I believe they have got some hearing aids also to help them, like to limit the hearing exposure, right? The noise exposure. They should be using that, right?
Yeah.
Okay, so doctor, what are the early signs of hearing loss and that people should watch out for?
So, as I said, conductive hearing loss we can pick up because any wax sitting there, or a patient had an accident, or they put some earbuds in the ear and the pain started, and then they start hearing loss, which is all pointing towards the problem in the drum, maybe a hole in the drum, or some pus coming out of the drum. So that is easy, and it is usually dramatic. You can see the pus. But the nerve hearing loss is a little tricky. It does not give any warning signs for most people. But some people have something called tinnitus. Tinnitus is frankly means ringing sound in the ear, ringing sensation. So it can be, it is not only a ring, it can be a buzzing, hissing, or a humming noise, or sometimes like a roar. So such noises come from our ear. They can be an indicator that the hearing loss can come following that. Some old people tend to have that in the earlier stage, and then they go on towards having hearing loss. So I would say tinnitus is an indicator people should watch out for. Sometimes tinnitus comes even with just a respiratory infection, but better to get checked when you have tinnitus to an ENT doctor and check your hearing levels also.
Right, right. Thank you, doctor. Doctor, we have got some questions from listeners. One of the listeners, Subi, is asking, I usually get ear pain during rainy season and cold weather. Sometimes pus. Then I consult ENT and recover. Now I'm 33. Will I get hearing loss?
So this falls into the category of the conductive hearing loss. So any pain or infection during the hearing during the rainy season means there's something wrong with her respiratory, the nose, and the tube that is connecting to the ear. We call it as eustachian tube, and which ventilates the ear. So drum. So what happens whenever the weather changes, the drum goes behind because of the negative pressure. There's pain. Sometimes it will perforate because of the excessive negative pressure, and pus comes. So such people, better to get checked to a doctor. If your drum is all right, I would say whenever the rainy season comes, beware that you don't pick up any viral infection very easily, because you tend to get more worse conditions. Or else you can see an ENT doctor once in 6 months to see how your drum is and make sure it is not perforated. And if it is perforated, there's a surgery that is done, and that can stop your hearing loss fear. You will not get hearing loss after that once you get a surgery. But the other category where I said there is no such warnings, no pain and no pus, just tinnitus, those people should be concerned that they will be having hearing loss or not. This question, this person can be easily treated, and she will not have a long-term hearing loss if regularly seen by an ENT doctor.
Understood, doctor. Understood. Thank you so much for that. And Subi, I hope that you have got the answer to your question. If you have any other questions, please do let us know. And then we have got a question coming in from Mr. Syed. He is asking, good afternoon, ma'am, and I have been using earphones for a long time. Is it safe?
Like I said earlier in the beginning, more than an hour with more than 60% of volume is bad. It's frank. Either you should a lesser volume for a longer duration, or better to use the over-the-ear headphones, or there's a new kind of headphones which is there now. I don't know if it is available in India. We call it as bone conduction hearing aid, where the hearing aid is placed here. So the sound goes through the bone here and not directly through the ear. These are little expensive. People who are in the profession of continuously have to talk through the phone, and they are in the move, so they have to wear the headphones. Such people can make use of the bone conduction hearing aids.
Understood. So there it is. There is your answer. I hope this is useful for you, Syed. And then moving ahead, we have got a question from Arun. He's asking, hi, doctor, is hearing aid the only option for hearing loss?
So that depends upon the hearing loss, sir, I would say. If it is a conductive hearing loss, an ENT doctor should actually see you first. If there is no problem, there is no pus, no pain, and hearing loss occurs in an elderly person where everything is normal except that the nerves are getting weaker, then hearing aid is the only option. But if it is a conductive hearing loss, there are many other options by which hearing loss will be treated, and those are very simple sometimes and maybe have a minimal surgery also.
Understood. Understood, doctor. So there is it. Arun, I hope you got your answer. Moving ahead, we've got a question from Edwin. Edwin is asking, while enjoying in local rivers while swimming, water stayed in ears with some dust. This lead to any ear problem, ma'am? She's asking this question. And any special method to clean that? You know, water retention while swimming or anything he wants to know.
So I think the question for his answer is there, lies in the question. So when you swim in clear water, for example, in maybe clear like swimming pool, we know that the water is good, so it will not do anything to you. Water which goes into the ear, unless your drum is perforated, it automatically comes back. Maybe it takes half an hour or one day, it comes back because there is no more to go. So you don't have to clean at all. But if you think that you jumped into a water where you think the water is not clean, then you can actually get an ear infection. In that condition, it is very important to not clean the ears yourself because already there is dirt inside, and on top of it, if you're going to use earbuds and make the dirt stick to the canal even more with the earbuds, it is not going to help. Please visit an ENT doctor at the earliest to clean. We actually have sterile techniques how we clean the ear. It is totally opposite of how buds work. We suction it out gently without any pain, so you know it is clear. I would say that if you think the water is not clean and you have dipped into the water for more than a half an hour or something, please consult your doctor and clean the ears.
Understood, doctor. So Edwin, I hope you got your answer. And if you have any other questions, please do let us know. There is a question from Syed again. This seems to be a different Syed. So good afternoon, ma'am. How to safely clean ear stains? So I think doctor has answered this question just now. So you can visit an ENT and doctor will help you to clean it through multiple methods. Example, suction is one of the methods. Doctor, would you like to add something in this? I believe you just covered this.
I know. I think many people have the question regarding how to clean our ears. So challenging thing for us to say, because a lot of pharma companies and very famous brands are actually producing a lot of earbuds which are amazing in quality, and they have the top-notch cotton being used. But earbuds will, if your ear wax, so this is a canal. It is open one side, but it is closed on the other side with the drum. So the moment you use earbuds, you cannot scoop it out. You're going to push it even more. Whatever is there, it's being pushed inside. So I would say earbuds usage should be stopped unless you feel it's only like small amount of ear wax which is sticking outside. You can maybe clean with the buds, but you should not put it way deep inside so that you push whatever is outside to inside. Then it's damaging to your hearing, and also can have ear pain and hearing loss. So this concept of ear cleaning should not even come. Ear cleans by itself. That is how nature has given it. You leave it, but the ear wax will automatically come out. When you roll in your sleep, when you run and walk, when you take bath, they automatically fall out. You can't even see that. But the moment we start using earbuds, this mechanism gets stopped and everything gets accumulated inside. Then you have to consult somebody professional to clean it out.
Right. So that doesn't help you. It only pushes the wax inside as per the doctor, doesn't pull it out. So better go and see a doctor, right? Or there is a natural mechanism that helps you. Now, moving on, we have a question coming in from Rajesh. Rajesh is asking, good afternoon, ma'am. For past 2 weeks, I can't speak loudly, and it means my voice is so low that I used to speak previously. Is that connected with throat infection or due to cold, ma'am?
Sorry, I couldn't get his question exactly.
So he's saying that he's not able to speak clearly and loudly is what he's trying to say. And the voice is much lower than what he was talking previously.
Okay, so that is what we call as laryngitis, even though it is unrelated to today's topic. So throat infection is what we have here, and our voice box is here. So when the infection goes from here down, it is called as laryngitis, where your voice is also hampered. I think you should see a doctor, see how bad is your infection, and should be started on antibiotics as early as possible, because such voice change takes at least 3 to 4 weeks to recover back. And there are other also better to see a doctor.
Right. So Rajesh, please do go and see a doctor at the earliest, and that should help you, and it will still take time, as doctor mentioned. Moving on, we have a question coming in from Ani, and she asked, ma'am, I'm working as a customer support. You know that we use earphones from morning till evening. Does it affect pregnancy?
Pregnancy will not be affected by using earphones. It's because it does not produce any radiation which can actually cross the baby and go into the placenta. But don't worry about the baby, but you should be careful that you don't damage your own hearing. As I said, it is to put the mobile phone on the loudspeaker mode and speak to the customers, rather than putting a headphone into the ear and damaging your ear. This has got nothing to do with the baby.
Understood, doctor. Okay, Ani, I hope you got your answer. Moving on, we have a question coming in from Mr. Vijay. Vijay is asking, good afternoon, doctor. May I know about the frequent period of ear cleaning? Because we don't clean every day. I think this also you have covered a little bit earlier around specific professions as well.
I think like how there is a new practice in the Western world where people go to the dentist once in 6 months to actually scale and do the cleaning.
Yeah.
Practice for ENT also. The kids and actually the doctor once in 6 months to regularly have a checkup on their ears, and if there's any wax, clean, rather than using home and damaging and coming in the last stage. So 6 months once to see a doctor, that should be fine.
That should be fine. So there it is, Vijay, your answer is there, and Rajesh is saying thanks for your valuable information, ma'am, and Ani is saying thank you for your answer, ma'am. Right. So I believe we are just close to the finishing our Instagram live, but let's cover a few questions. Doctor, can hearing loss be reversed or restored if happened after a road accident?
So yeah, that's a tricky question. So as I said earlier, road traffic accidents can cause damages in multiple levels. So only when the drum is perforated, then we can repair the drum. Maybe sometimes when we give antibiotics and drops, the perforation closes by itself. So that is only medical management. But if the drum hole is big, then we have to do a surgery to close the drum. Then the hearing loss will come back to normal. So that is one level. The next level is when the bone behind the ear gets fractured. That's where our important nerves are crossing. So because of the fracture, the nerve gets cut there, there's no way we can get the hearing loss back. So that is going to be a permanent.
Understood, doctor. Thank you for that. And moving on, doctor, can everyone with hearing loss wear hearing aid? So the question is, can everyone with hearing loss wear hearing aid?
So again, conductive hearing loss requires medicines and surgery, whereas sensorineural hearing loss is hearing aids. When we say when the hearing loss is worse, we call it as a term is called as profound hearing loss. When the hearing loss is more than 90 decibel, then even hearing loss does not help. There's another surgery called as cochlear implantation, or something very fancy called as brainstem implants, which is very rarely done in India. So only these surgeries can help for the nerve part. If it is a conductive loss, first medical management, treating with antibiotics, seeing what is wrong with the drum, undergoing a surgery for closure of the drum perforation should help.
Okay. Thank you for sharing that, doctor. Moving on, the last question of the day, doctor. Doctor, what is sensorineural hearing loss and what treatment options are available for that?
I think I just now told that is the nerve hearing loss. So it usually is when there is a, like you said, there is a syndrome associated when the baby is born, and the baby is born with a hearing loss because the mother has genetic problem. So such hearing loss or sensorineural hearing loss. And elderly people, when the age is more than 60, 65, what they get is also sensorineural hearing loss. Such hearing loss people are mostly benefited only by hearing aids or cochlear implantation.
Right.
Right. Treat normally.
Okay. Thank you so much, doctor, for clearing a lot of doubts of people, because this is a very, very common. We had, so many questions during our session. I'm sure people would find this very, very insightful. And guys, do check out Cureka.com, and you can get more insights upon any concern using your WhatsApp platform. So, doctor, thank you so much, and wish you a very, very happy weekend. We do look forward to connecting with you again sometime in future. And thanks a lot again. Take care, doctor.